My name is Ashley Parker. I'm a pediatric speech-language pathologist, and I work at UF Health Outpatient Rehabilitation at Wildlight. Speech pathology is a really broad profession, which is part of what makes it so great because you can kind of pick and choose some of your specialties. So for me, I've chosen to work with pediatrics, and in general, we work with children who have difficulty either saying their sounds right for words. They might have difficulty understanding what words mean. Sometimes they have difficulty picking the right words to say or talking at all. And we also help with things like pediatric feeding, swallowing, and behavior difficulties. One of the most rewarding things about being a speech-language pathologist is that I get to listen to kids say their very first words. I get to hear children not just use communication to get what they want or they need. Like, it's great that a kid can say, I want juice or I want a cracker, but like just a couple of weeks ago, I had a mom say that every night for the 3 years that she has had her child, she puts him to bed and she says, love you, love you, love you. And after about a month of coming to see me for the very first time, he looked right at her and he said, love you, love you, love you, right back. When I hear things like that, not just as a therapist, but also as a mom, it not only keeps me going whenever sometimes it can be a little bit of a more difficult day or something like that, but it reminds me that what I do is a science, but how we do it comes from the heart. Well, one of the best things about our practice is that we are able to provide pediatric speech therapy, occupational therapy, and physical therapy. The great part about that is that it's very rare that we have one child who only needs one discipline. A lot of kids who have significant developmental delays benefit from 2 or sometimes even all 3 disciplines, and this is a one-stop shop. And that's really great because we can talk with each other and we can really make the therapy exactly what that child needs rather than having to talk with a physical therapist at this practice and a speech therapist over here. We all work together day in and day out, and we will talk to each other and give the child the therapy that we think will be the best thing for them.